Okay, I'm knocking. Hi, my name's Lauren. I'm going to be your nurse for today. We're going to go ahead and do a head-to-toe assessment. I'm going to go ahead and wash my hands and provide privacy. Can you go ahead and tell me your name and date of birth?
Yes, it's John and June 1st, 1970.
Okay, I'm going to go ahead and look at your armband just to make sure all that's correct. Perfect. Can you go ahead and tell me the date?
Today is December of 2020.
Okay, and about the time of day?
It's about 7:30 p.m.
Okay, and where are you at?
I'm in Gainesville, Florida.
Perfect. Patient's hygiene is adequate. His posture is good. He has appropriateness of speech and good hygiene. Okay, I'm going to go ahead and start by inspecting your head. All right, there are no evidence of lesions, parasites. The hair is evenly distributed as well. And then upon palpation, there's no masses, no deformities. I'm going to go ahead and have you take off your glasses for me.
Okay.
Okay, and then go ahead and palpate your maxillary sinus as well as your frontal. All right, can you go ahead and smile and frown? Okay, open and close your eyes. All right, puff out your cheeks. Okay, and then go ahead and swallow for me. Perfect. Okay, muscles are smooth and strong. Cranial nerves 5, 7, and 10 are all intact. Also, can you go ahead and close your eyes and tell me where I am touching your head?
My forehead, cheek, my left cheek, the chin.
Perfect. Okay. And I'm going to go ahead and inspect your eyes. Eyebrow and eyelash hairs are evenly distributed. There's no evidence of discharge, redness, or lesions upon inspection of the external conjunctival sac. I'm going to go ahead and shine this light in your eye, okay?
Okay.
Perfect. And go ahead and follow the pen light. Don't move your head, just follow it to your nose. All right. Go ahead and I'm going to go and do the 6 directional cardinal gaze. Again, just don't move your head, follow it with your eyes. Okay, cover one eye for me.
Okay.
And let me know what number you see.
2, 2,
Okay, other eye.
1, 1.
Perfect. All right, and we're going to go ahead and read off the Snellen chart. You can go ahead and put your glasses on for me. Patient was able to read line 8, so he has 20/20 vision. Cranial nerves 2, 3, 4, and 6 are all intact. I'm going to go ahead and inspect your ears. Okay, and I'm going to palpate, and you're on your pinna and tragus. Do you feel any tenderness when I did that?
No.
Okay. There's no discharge, lesions, no excess cerumen, and no redness as well. I'm going to go ahead and do a finger rub test. Have you had any recent changes in hearing?
No.
Okay. Close your eyes for me and just let me know what side you hear it on, okay?
My right. My right.
Okay. Patient's cranial nerve 8 is intact. He did have a little bit of trouble with hearing. I'm going to go ahead and inspect his nose. Go ahead and just look up at the ceiling for me. Perfect. Oral mucosa was pink and moist. No excess discharge. There was no deviation. Okay, can you go ahead and plug your nostril for me and include that and blow out? Okay. And okay. The nares bilaterally were patent. And I'm going to go ahead and inspect your lips. They are normal in color, no lesions, no excess drying or cracking, and they are normal in color. Okay, go ahead and open your mouth for me. I'm going to go ahead and inspect your gums. Typically, I would use a depressor. The gums are normal in color. There's no redness, no inflammation, and they are moist. And upon looking at, go ahead and open up for me. Upon looking at the oral mucosa, it is pink and moist, no lesions noted. Okay, sorry, open again. And the tongue, there's no apparent redness, no roughness. It is moist. And go ahead and stick your tongue out for me. Move it side to side, up and down. Okay. And stick your tongue out and say ah. Okay. Tonsils are present when asked to say ah. The uvula pronates midline, tongue was midline, he was able to move it side to side, no problem. Cranial nerves 9 and 12 are intact, and earlier patient was able to swallow adequately, so cranial nerve 10 is intact as well. Okay, I'm going to go ahead and inspect your neck. It is midline, there's no masses upon inspection, and it is symmetrical. I'm going to go ahead and palpate. Again, there's no masses, no deformities. Noted. Can you go ahead and move your head side to side for me? Up and down, and ear to shoulder. Okay. Try to open your mouth against resistance, and shrug your shoulders against resistance. Okay, perfect. Cranial nerve 11 is intact. All right, I'm gonna go ahead and palpate for the thyroid. The trachea is midline, and the thyroid is not palpable, it's not enlarged. I'm gonna go ahead and palpate all of the lymph nodes. Here under the chin is the submental, there's the submandibular, tonsillar, post-auricular in front of the ear, or pre-auricular, post-auricular behind the ear, behind the head is the occipital, anterior cervical chain, posterior cervical chain, and supraclavicular. All right, all lymph nodes were normal, they were not enlarged. Okay, looking at the thorax, the patient's respiratory rate, rhythm, and depth are all within normal range. The patient's thorax is symmetrical and elliptical in shape, which is normal. I'm gonna go ahead and listen to your breath sounds, and these are the anterior breath sounds. Okay, and on each time I move my stethoscope, just inhale and exhale, okay? Perfect. Perfect. Anterior breath sounds were clear and equal. Go ahead and lift your arm up for me and listen to the auxiliary breath sounds. Inhale and exhale. Same on this side. Okay, auxiliary breath sounds are clear and equal bilaterally. I'm going to go ahead and have you turn around for me in the chair. Okay, and these are the posterior breath sounds. Go ahead and inhale and exhale. Okay, posterior breath sounds are clear and equal. And I'm going to go ahead and check for spinal alignment. Okay, spine was in line. I'm going to go ahead and check for CVA tenderness. Just let me know if you feel any tenderness, okay?
Okay.
No tenderness?
No. No.
Okay, perfect. I'm going to go ahead and check for thoracic expansion. So you're going to put your hands in kind of a W shape. Go ahead and inhale and exhale. Okay, thoracic expansion was normal. I'm going to go ahead and do the tactile firmitis. Each time I move my hands, just say 99.
99, 99, 99, 99.
Perfect. Tactile firmitis had normal vibrations. Okay, you can go ahead and turn back around for me. Okay. And we're going to test some range of motion. Go ahead and put your arms out like this,
okay,
and circles,
okay,
up and down, and out in front of you. Perfect. Go ahead and stand up for me. Same things with your legs and circles. Same on the other side. Up and down. All right, and out in front of you. Perfect. Patient has full range of motion. Okay, put your arms up like this, okay, and push against my resistance. Pull. Okay, go ahead and sit back down just for 1 second.
Okay.
same things with your legs. Push against my resistance and pull. Okay, perfect. We're gonna go ahead and test your coordination. If you can stand back up. And go ahead and take 3 steps forward,
Okay.
and then 3 steps back.
Okay.
Perfect. And then go ahead and put your arms out like this, and finger to nose. Okay, heel to shin.
Okay.
All right, and then feet together, close your eyes. We're gonna do the Romberg test.
Okay.
And 20 seconds fast forward. Romberg test was negative. Gait and balance were both normal. We're gonna go ahead and test your motor strength. You can sit down.
Okay.
Okay, I'm gonna go ahead and have you squeeze my fingers.
Okay.
Perfect, kind of like that.
Okay.
There you go. Okay. And then we're gonna do dorsiflexion. Go ahead and push your feet up against my resistance and down against my resistance. Okay, so dorsiflexion and plantar flexion are both good strength, as well as all the other motor functions are all intact. We're gonna do sensory function now. Go ahead and I'm gonna do sharp and dull. So we're gonna use this for the sake of the demonstration. Just let me know whether you feel sharp. So there's sharp
Okay.
or dull.
Okay.
Okay, close your eyes for me.
Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull.
Okay. All right, you can open your eyes, and then I'm gonna take your hand,
Okay.
and you're just gonna let me know whether you feel your finger up
Okay.
or down. Go ahead and close your eyes.
It's up, down,
Other hand.
up, down,
Okay, same on your foot.
up, down, up, down.
Okay, I'm gonna go ahead and check capillary refill. And you can go ahead and open your eyes as
Okay.
well. Okay, patient sensory functions are intact, and capillary refill is 1 to 2 seconds. Okay, I'm gonna go ahead and we're gonna listen to we're gonna find your carotid pulse, and we're gonna do this one at a time. Perfect. Carotid pulse is strong and equal bilaterally. I'm gonna go ahead and listen to your carotid pulse, and we're gonna use the bell side. Listen for any bruits. Okay, good. Inhale and hold the exhale. Perfect. Inhale and hold the exhale. Perfect. Okay, no bruits were noted. I'm gonna go ahead and feel your chest for any thrills or heaves. You're gonna feel here for the base of the heart, left sternal border, and apex. Okay, no thrills or heaves were detected. Now I'm gonna go ahead and listen to heart sounds. Here on the right sternal border, second intercostal space, we have the aortic valve, and the second intercostal space, left sternal border, pulmonic. Third intercostal space, Erb's point. Fourth intercostal space, tricuspid, and then mid-clavicular line. Fifth intercostal space is the mitral valve. Okay, S1 and S2 sounds were present. S3 and S4 sounds were not. All right. I'm gonna go ahead and have you lay down on the couch for me.
Okay.
Okay, and before I do that, I'm going to, have you sit up.
Okay.
Okay, so I'm gonna go ahead and check your other pulses.
Okay.
Here we have the radial, or the brachioradialis here, and then the bicep. Okay, and then we have the popliteal, and this one's behind the knee. We have the posterior tibial behind the ankle, the dorsalis pedis right here. Okay, and then we're going to test your reflexes. For the sake of the demonstration, I'm just going to use my stethoscope beside of the diaphragm. Okay, just have your arm dangle.
Okay.
And I'm going to test your tricep. Okay. And then have your arm like this. And we're going to test your bicep. Okay. And then here, we're going to test your radial. Okay. We're going to do your patellar, and typically his foot would be dangling. Okay, and we're going to hit just below the knee. And then hold the foot up like this, and behind the ankle, hit the Achilles. And the plantar reflex going in a J shape towards the big toe. Okay, now you can lay down.
Okay.
Okay, I'm gonna go ahead and listen to your bowel sounds. Okay, and we're gonna do the right upper quadrant, left upper quadrant, left lower quadrant, and right lower quadrant. Okay, I'm gonna go ahead and palpate, and you just let me know if you feel any tenderness, okay?
Okay.
Right upper quadrant, left upper, left lower, and right lower. Okay, any tenderness?
No tenderness.
Okay, you can go and sit up for me. All right, and when was your last bowel movement?
Early this morning?
Okay, great, nice to hear. Do you have any issues voiding?
No.
Any pain with urination?
No.
No? Okay, perfect. This concludes our exam. Do you have any questions?
No, I do not.
Okay, are you comfortable?
Very comfortable.
Perfect. Here is your call light,
Thank
and
you.
here are all your personal belongings, ensuring safety. I'm going to go ahead and wash my hands and remove privacy.
Thank you.